Welcome to May 2022. My name is Robert Tasker and I'm your Editor-in-Chief of Pediatric Critical Care Medicine. As with previous months, 3 choices that you should focus on before reading the rest of the journal. The first is by Rivera et al. And this is an article that uses machine learning to track in real time mortality risk in 27,000 admissions with an overall mortality rate of 1.8% and the lessons learned from this type of study. And we have an accompanying editorial. Then, as my second choice, this is a bit of a cheat in that I've grouped together 3 articles with an editorial. The reason for grouping them is because I got 3 articles on the topic of vitamin C and thiamine. We start with an editorial by Nilesh Mehta, who gives us the context from the Surviving Sepsis Guidelines and what it is that we can learn from these papers to do with vitamin C and thiamine. The first study is from Switzerland by Equerry et al., and they study vitamin C and thiamine in pediatric sepsis. The second study comes from the United States, and that's by Fathi et al., looking at vitamin C. And the third study is by Akuzo et al., looking at thiamine in a population in Turkey. So a good read, consider the whole bundle as one thing. And my third choice is real-time POCUS, or point-of-care ultrasound, when trying to place a central umbilical venous access after blind venous access has failed. It's a beautiful technical note from 3 tertiary centers, headed up by Koziak et al., and the illustrations are amazing, and there's some videos as well. Then for the PCCM connection section for regular readers, I thought we would focus on congenital heart disease. There's a great concise clinical science review on acute kidney injury after cardiac surgery. The second article in the congenital heart disease theme is about opioid weaning after Norwood procedure, morphine versus methadone. And then the third article is about airway characteristics in young patients with 22q11 deletion who are having pulmonary artery reconstruction. So that's the PCCM connections. And then the last piece that I draw your attention to is the PCCM narrative essay. And this month it's called Timing is Everything. So I commend all of this to you. I commend the whole journal to you. So enjoy your read. See you next month.